Health is wealth, goes the popular saying. It therefore follows that in every country, the health sector is critical to social and economic development, as there is ample evidence linking productivity to quality of healthcare. No doubt, human capital development is strategic to the socio-economic development of our nation. Investing in human capital development is therefore critical, as it is targeted at ensuring that the nation's human resource endowment is knowledgeable, skilled, productive, and healthy to enable the optimal exploitation and utilization of other resources to engender growth and development. However, over the years, the health indicators in Nigeria were below country targets and internationally set benchmarks, including the MDGs, which had recorded very slow progress over the years. The health sector was characterized by ineffective stewardship role of government, fragmented health service delivery, inadequate and inefficient financing, weak health infrastructure, maldistribution of health workforce, and poor coordination amongst key players. The country's vision of becoming one of the leading 20 economies of the world by the year 2020 is closely tied to the development of its human capital through the health sector. The unflattering effect on Nigeria and Nigerians has been an economic growth on paper without a corresponding and visible improvement in the overall standard of living of the people. Today, the administration of President Goodluck Ebele Jonathan has reversed such a trend by translating promises to actions with an unprecedented purpose-driven administrative style towards achieving sustainable universal access to quality health services in Nigeria. By so doing, President Jonathan has therefore demonstrated a clear vision of what needs to be done to get Nigeria moving again. To strengthen the weak and fragile national healthcare delivery system and improving its performance, the government initiated a process that led to the development of the National Strategic Health Development Plan 2010 to 2015 (NSHDP), which was developed in a highly participatory manner. The health sector has witnessed remarkable achievements which are in line with the 8 priority areas of the NSHDP, the health component of Mr. President's transformation agenda and the National Vision 2020. These key areas include leadership and governance for health, health service delivery, human resources for health, financing for health, National Health Information System, community participation and ownership, partnerships for health, and research for health. Under the Jonathan administration, Nigeria's health sector has witnessed the greatest level of interventions in terms of infrastructure development and the delivery of health services, especially at the grassroots. The administration is credited with refurbishing and modernizing federal tertiary hospitals across the country. Some of the projects include the rehabilitation and equipping of Obafemi Awolowo University Teaching Hospital, Ile-Ife, the University of Benin Teaching Hospital, the Nnamdi Azikiwe University Teaching Hospital, the University of Calabar Teaching Hospital, and the Jos University Teaching Hospital.
The governor of the state looked at the needs of Ebonyi State and felt that this state was one of the last states to be created, and there were many things that needed to be done. And one of them was to rapidly increase the turnover of new health workers that are being trained and turned over. The state already had a medical school and they had a teaching hospital, but combining the two institutions to form a bigger hospital with more than 600 beds now also increases the capacity for training, but more importantly also increases the capacity for delivering tertiary health services. So this is actually, if you like, the newest federal government-owned teaching hospital.
A lot of effort has gone into play in order that we could provide for the early detection of this kind of cancers. Screening for the commonest cancers that are bedeviling our population, that is breast cancer, cervical cancer, and prostate cancer in men, because these are the commonest cancers for now that are of deep concern to the nation.
We have 8 functional dialysis machines. As you can see, they are all running and servicing at least a total of 15 patients.
It is on record that following the upgrade of health facilities in the country, several remarkable milestones and breakthroughs have been recorded. Some of the landmark achievements include: first, successful stem cell transplant for sickle cell patients in January 2012 at the University of Benin Teaching Hospital.
The stem cell, we have only used sickle cell as an example. It is not directed specifically at sickle cell patients only. Even patients from here will benefit. If you subject a patient to that treatment, by the time the patient comes out, the immunity is also low and he could die. So, but he can benefit from here. So, the coordinator is a leader in the Hematology Association of Nigeria. So that is where they handle issues regarding sickle cell anemia.
Kidney transplant surgeries successfully carried out in 2012 at Obafemi Awolowo University Teaching Hospital, Ife, Aminu Kano University Teaching Hospital, Kano, University College Hospital, Ibadan.
This is one of the facilities in the permanent site. This is the renal dialysis unit. It is for those who have kidney failure. So one of the initial treatment is to use artificial kidney. That's what it is. That's dialysis is all about, an artificial kidney doing the same work that the natural kidneys ought to do.
Open heart surgery at the Center of Excellence for Heart Disease at the University of Enugu Teaching Hospital after 8 years. Microsurgery of the brain is also now being conducted at the Federal Medical Center, Umuahia. Total knee and hip replacement at National Orthopedic Hospitals in Enugu and Igbobi, Lagos, as well as Federal Medical Center, Yenogwa, and the University of Benin Teaching Hospital, among others. Other notable milestone achievements of the Goodluck Jonathan administration include the establishment of National Trauma Centers in the University of Abuja Teaching Hospital and the National Hospital, Abuja. Collaboration between the Federal Ministry of Health and Chinese government to complete and equip the permanent site of the Federal Staff Hospital, Jabi, Abuja. The hospital was commissioned by the President on 28th January 2013. Others are completion of the National Institute for Pharmaceutical Research and Development NIPRD main administrative and laboratory building, acquired property to house the administrative headquarters of the Medical Laboratory Science Council of Nigeria and the Nigeria Center for Disease Control, respectively, and inauguration of a ministerial committee for unlocking of the private sector potentials for the establishment of world-class specialist hospitals and high-end diagnostic centers in each of the 6 geopolitical zones of the country. Another key area of intervention which the Jonathan administration has added another feather to its cap is in maternal, newborn and child health, MNCH. The Shorepay Maternal and Child Health Program is a nationwide health development initiative that is helping to increase patients' access to skilled human resources by scaling up the Midwives Service Scheme, amongst others. Under the Shopee and the Saving 1 Million Lives initiative, human resource for health has been increased and jobs created by recruiting an initial 3,960 healthcare workers to provide MNCH services in 500 Shopee-supported primary healthcare PHC centers spread across the 36 states and FCT. Since 2011, the administration of President Goodluck Ebele Jonathan has remained committed to achieving universal access to contraceptive commodities at all levels and has been investing a total contributory sum of $8 million annually. To date, more than 10,000 healthcare workers have been retrained and re-engaged to provide services in more than 600 participating health facilities. These facilities are well stocked with supplies without any supply running out of stock in the period in question. These healthcare workers comprise midwives, health extension workers, and female village health workers. The administration is now accelerating its development of the people's access to healthcare services and financial risk protection as it targets the attainment of universal health coverage by 2015 as contained in the National Strategic Health Development Plan. President Goodluck Jonathan has reaffirmed his commitment to the project of universal health coverage in Nigeria, emphasizing the importance of this project to the ongoing transformation agenda of the present administration. During the recent presidential summit on universal health coverage, he said, quote, "In this our centenary year, we will continue our efforts through the Saving 1 Million Lives initiative to strengthen primary healthcare services. We will scale up interventions in reproductive, maternal, newborn, and child health, nutrition, routine immunization, HIV/AIDS, malaria elimination, tuberculosis, neglected tropical diseases, and non-communicable diseases. We will pay greater attention to the provision of universal health coverage. Besides the implementation of new initiatives such as My Comprehensive Response Plan for HIV/AIDS, we shall continue to collaborate with global health partners to deliver our health sector transformation agenda." Unquote. The March 2014 Presidential Summit on Universal Health Coverage itself was an affirmative event that practically strengthened the commitment of all stakeholders, including government at federal, state, and local council levels, as well as the civil society and the Nigerian people at large. The Great Summit produced the popular 2014 Declaration and flagged off a universal healthcare movement in Nigeria, with all eyes on a program to fast-track actions that would achieve at least a 30% prepayment scheme coverage by 2015. With the successful launch of TrustScan for detecting fake drugs by Mr. President, the war on substandard, fake, and counterfeit drugs has been raised to a new level. Through its agency, the National Agency for Food and Drug Administration and Control, NAFDAC, the administration has achieved the following: deployment of ICT for detection of fake and counterfeit drugs, TrustScan, and text messaging technique, WHO accreditation of local pharmaceutical industries for drug production, introduction of the text messaging technique for the authentication of drugs.